Hello, my name is Divya, and today I'm going to take your interview. So, introduce yourself.
My name is Ananya and I'm occupational therapist assistant and physiotherapist assistant student.
So, why did you apply to this position within our organization, and what do you know about us?
So I applied for this position because I'm deeply passionate about making a positive impact on the lives of older adults. Intra's commitment to provide compassionate care and enhance the quality of life for elderly clients aligns with my personal values and professional goals. From what I know about Intra, your dedication to diversity in the workplace makes this an ideal place for me to grow as a caregiver and contribute to the community.
Okay, so tell me about a time you were unsuccessful or disappointment in yourself. Be specific. What were the circumstances? What happened? And if you could do it over again, what will you do differently?
In my previous caregiving role, I was tasked with ensuring that a client's medication schedule was followed closely. I made an error in following the chart and which led to a missed dose. This was a very big disappointment for me because I always want to be detail oriented and dependable. After that incident, I immediately informed my supervisor about the situation, and the client received all the necessary medical attention. If I could do something all over again with that situation, I would have double checked the medication log more thoroughly and asked for assistance if I was unsure. I learned the importance of clear communication and double checking critical tasks in caregiving.
Okay, so tell me about a time you experienced a conflict with a colleague. Be specific. What were the circumstances? How do you handle things, and what you will do differently?
So, in my past caregiving role, I worked with a colleague who had a really very different approach than mine. So, there was a disagreement about the best way to approach a client's personal care routine, and we initially had some disagreements and arguments or heated conversations because of that. But later on, we addressed the issue by discussing and differing approaches openly, listening to her concerns and suggesting a compromise that would best suit with the client's preferences. It was really very important to prioritize the client's needs over our personal differences because the client centered treatment plan is what we do. So, if I could do anything differently, I would engage in an open communication earlier to clarify our roles and responsibilities before any conflict arises.
Okay, so tell me about your proudest accomplishment.
So, my proudest accomplishment was when I helped a client to transition from a hospital to a home care. So, my client, not my client apparently, the client was initially apprehensive about returning home due to the mobility challenges. I worked with them daily, provided them the emotional support, assisting with the physical activity and physical therapy exercises, and making sure they felt comfortable and safe. By the time passed, they regained their confidence and independence in their daily activities. The sense of accomplishment came from seeing their progress and knowing I contributed to improve their quality of life was my proudest accomplishment.
Okay, so based on the knowledge, skills, and experience you have from the OTA PTA program, describe why would you be the best fit to this position.
So, my experience in OTA PTA has equipped me with a strong foundation in assisting clients with physical rehab and daily living activities. I have developed skills in patient assessment, creating care plans, and supporting individuals with physical and emotional needs. My ability to connect with clients on a personal level and understand their needs allow me to provide compassionate, individualized care. I'm confident that these skills, combined with my genuine passion for helping others, make me a great fit for a caregiver position at Intra.
Okay, so now the interview questions are completed. Do you have any question for me?
Yes, thank you for the opportunity. And I have a couple of questions. So, how do you support your caregivers in their professional development and training? And can you describe the team dynamics here and how caregivers collaborate with other healthcare professionals? Thank you.